Go.
Hi, my name is Sherry. I'm going to be doing the head, eyes, ears, nose, and throat exam. This is my patient Sheila, my lovely assistant Sydney. She's thirsty. Alright, so first we're just going to do an overall inspection. Look for symmetry, eye symmetry, ear symmetry, hairline, hair thickness. Everything appears normal. So the first thing we're going to do is examine her lymph nodes, which we're going to start pre-auricle. They should not be palpable. Post-auricle, parotid, lymph collector, all the way down. And they are not palpable, so that is normal. So we're going to start with the cranial nerves now. The cranial nerve number 1 is the sense of smell. So I'm going to have her close her eyes. And close one nostril. What do you smell?
Coffee.
Okay. And again, what do you smell?
Vanilla.
Okay. Her cranial nerve number 1 is intact. So now we're going to do cranial nerve number 2, which is her eyes. So I'm going to test her vision. So I'm going to have her read the smallest line on here that she can.
927-865-84.
927-86524. So she's 20 out of 25. Then I'm going to have her identify colors too. What color is this?
Red.
Okay. What color is this?
Green.
So she doesn't appear to be colorblind. Your cranial nerves number 2 is intact. So now we're going to do cranial nerve number 3, 4, and 6. With this, I'm going to test her visual fields. So I'm going to have her follow my pen in, look for accommodation, and there's pupil constriction. So I'm going to have her test the 6 cardinal gaze up. And she's able to follow, so that is intact. So I'm going to have her test her peripherals. So I'm going to have her tell me when my hand comes in her field of vision.
Down. 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 Down.
And they all seem to be intact. So now I'm going to do cranial nerve number 5, which is facial sensation. Thank you. So I have her close your eyes. And where am I touching you?
Cheek.
Is it dull or sharp?
Dull.
Okay. And how about here?
Dull. Chin.
Okay. Here.
Dull. Chin.
Here.
Dull. Forehead.
Okay.
Dull. Forehead. Sharp. Cheek.
Okay.
Sharp. Cheek.
Okay. And she does have feeling in all quadrants, and she's identified whether they're dull or sharp. So now I'm going to check her facial muscles. So I'm going to have her clench her teeth. Just check her muscles, make sure they're symmetrical, and they are, and symmetrical here. So next is cranial nerve number 7, it's just facial movement. So I'm going to have her do some facial expressions. So I'm going to smile, look for symmetry, and frown, and pucker, and blow your cheeks out, and gut. She's able to follow and do all of them, and there is symmetrical movement. So now I'm going to check cranial nerve number 8, which is the whisper test. So I'm going to whisper something in her ear and have her repeat it.
5B6.
And the other ear?
5B6.
And she is able to repeat it, so her hearing is intact. So now we're going to do cranial nerve number 9 and 10, which is the gag reflex and the uvula movement. Okay, so I'm going to have her open her mouth and look with the pen light. Just inspect the mouth while I'm in here. Just check for lesions. Tongue from side to side. Okay. Okay, I'm going to say ah. Uvula rise and it's midline. I'm going to check her gag and it's present. Alright, so now I'm going to check cranial nerve number 11, which is the sternocleidomastoid trapezoid. So I'm going to check her strength, have her shrug her shoulders against my resistance, and she has good strength. and push your head towards my hand. Okay, and the other way. Now tilt it down. Good. And tilt it down. And she has good muscle strength there. So now I'm going to palpate her thyroid gland. And it should not be palpable, which it is not. So now I'm going to check her carotid pulses one at a time. Pulse is present. And her pulse is present as well. Now I'm going to just examine for jugular vein distension, which she appears to not have any. So now I'm going to do an otoscopic exam. I'm going to use my otoscope. First, I'm just going to turn it on. Yeah. All right, it's on. So now I'm just going to look at the outer portion of the ear with the light. Just look at her skin, the pinna, behind the ear. Just look for lesions or any abnormalities. So then I'm going to look in her ear. I'm going to hold the otoscope like this. Brace my hand, pull the pinna up, back and up, in, look for the tympanic membrane, which there it is, and it appears normal. So I'm going to do the same on the other side. Examine the outer ear, look for any abnormalities or lesions. Okay. Brace the skull, pull the pinna up and back, in, look for the tympanic membrane. And it appears normal as well. All right, so now I'm going to palpate for her sinuses, checking for any soreness or pressure. Any discomfort?
No.
No? Maxilla?
No.
And no discomfort there, so her sinuses appear to be normal. And that concludes the head, ears, eyes, nose, and throat exam.